Do you know the fastest way to fail your MBBS surgery Viva? It's not lack of knowledge, it's poor case presentation. I have seen students who could recite daily and love line by line, yet the moment they started presenting a case, they collapsed under stress. And I have seen others with average knowledge walk away with distinction, all with the same examiner. The difference? Strategy. Remember, even the toughest examiner is not there to fail you. They are testing whether you can think, speak, and examine like a safe doctor. Today, I'll show you how to present a surgical case like a topper, step by step, plus the practical tricks to handle strict examiners with confidence. Your case presentation is the heart of your exam. In those 5 to 10 minutes, the examiner has already formed an impression about your clarity, confidence, and surgical maturity. Here is the topper's secret. Case presentation is not about showing off your memory. It's about showing your clinical thought process. A neat, structured, and calm delivery show the examiner that you are exam ready and ward ready. Let's take a common case. A patient with swelling in the right groin. How do you present it like a topper? First, introduction. This is Mr. X, a 45-year-old gentleman, resident of Latur, farmer by occupation, presenting with swelling in the right groin for 6 months. Crisp, to the point, don't add unnecessary background here. Then comes history of present illness. Describe onset, progress, duration, aggravating and relieving factors with any diurnal variation. Do tell if there is any associated symptom. For hernia, swelling increases on standing, reduces on lying down, associated with dragging pain, no history of sudden irreducibility. Negative history is important. Rule out differential diagnosis, find etiology, and ask for complication in negative history section. For example, say what is not there, because that reassures the examiner that you are thorough. Past, personal, and family history. Do mention about them in detail. For example, in hernia case, history of previous surgery, ask about chronic cough, constipation, urinary straining, addictions, etc. Mention significant history like familial hernia, tuberculosis, smoking, alcoholism, asthma. Now about the general examination, say systematically vitals, pulse, BP, temperature, respiratory rate, BMI, and dehydration. Comment on nutrition, anemia, pallor, cyanosis, clubbing, etc. While you come to the local examination or examination of the inguinal scrotal region, this is where the most students lose the track. Follow a checklist approach. For example, in inspection, site, size, shape, skin changes. Whereas in palpation, tenderness, temperature, consistency, cuff impulse, reducibility. Special tests like expansile cuff impulse test, reducibility, deep ring occlusion test, and if required, Zeeman test or ring invagination test. Systemic examination, never skip it. Even if it's brief, no abnormality detected in respiratory, cardiovascular, or abdominal system will suffice. Per rectal examination, especially in hernia and abdominal case, is must. Then present summary and diagnosis in one confident sentence. For example, so, in summary, this is a middle-aged gentleman with reducible cuff impulse positive right inguinal hernia, most likely right-sided indirect inguinal hernia with enterocele without any complication, benign prostatic hyperplasia as the etiological factor with good muscle tone. This is how you should be telling about the diagnosis. Always end with a provisional diagnosis and possible differentials. Now, here are the secrets to impress examiner. And this is the part most students miss. The subtle things examiner look for. Let me give you 3 insiders tip. Tip number 1. Confidence beats cramming. Don't sound like a parrot. Speak like a young doctor presenting on ward rounds. Tip number 2. Anticipate Viva questions. If you are presenting a hernia case, be ready to answer how do you differentiate direct from indirect hernia clinically? Or why mesh is contraindicated in infections? What is your diagnosis? How will you manage this case? Prepare 2 to 3 Viva linked answer with each case. Tip number 3. End with management plan. Even if examiner doesn't ask, slip it in. My management would include patient optimization, surgical repair by open anterior approach mesh hernioplasty, or laparoscopic approach depending on the patient's factor. That shows maturity. I know you are thinking, what if the examiner is strict? Here is what works. Tough examiners often start with a rapid fire or intimidating tone. Stay calm. Don't panic. Buy time. If you don't know immediately, use phrases like, let me think aloud, or may I clarify the question? This buys you 3 to 5 seconds to recollect your thoughts. And examiners respect a student who thinks logically rather than blurting random answer. Remember, Confidence is contagious. If you stay composed, the examiner subconsciously eases up. Answer what is asked. Don't vomit your memory. Focused answer impress examiners. Irrelevance irritates. If asked, how do you differentiate direct versus indirect inguinal hernia clinically? Don't start explaining the entire anatomy of inguinal canal. Give focused, crisp points. Precision is what wins marks with tough examiner. Admit when you don't know the answer. Here is a secret. Examiners already know what you don't know. If you fumble, it's obvious. Instead of bluffing, say, I'm not sure about the exact detail, but I think it is related to that shows honesty and reasoning ability. Many a times, examiners guide you through the answer, but if you bluff, they push harder until you break. Turn defense into offense. When a tough examiner challenges you, they want to see if you crumble. Instead, use it as a chance to show maturity. For example, examiners ask, so you think mesh repair is always safe? What about infection? Instead of panicking, reply, sir, you're right. Mesh has risk of infection. That's why in contaminated field, we prefer tissue repair like Bassini or Schuldices. See, you have acknowledged their point and added depth. That's how topper impress examiners. Remember your posture, voice, body language, everything matters. Sit straight, maintain respectful eye contact, and keep your voice steady. Even if you make a mistake, looking confident makes the examiner believe you are worth extra marks. Remember, sometimes it's the small omission that costs the most. Another student blanked out when asked about the thyroidotomy complication. Instead of panicking, he said, sir, I need a moment. But I remember the most important is recurrent laryngeal nerve injury causing voice change. That one confident line saved him. He passed. The difference was not knowledge, it was composure. That's why toppers always run a mental checklist before finishing. So here's the bottom line. Case presentation is not about being perfect, it's about being structured, logical, confident, and examiner friendly. Show your thought process, anticipate Viva questions, and finish strong with management. That's how you present like a topper. If this helped you, hit like, comment the next case you want me to cover, and subscribe now to stay ahead in your medical career. Don't wait till exams. Start practicing now because the ones who prepare early are the ones who score highest.